I was a medical student here back in the 80s, and I was just drawn towards pediatrics because the Children's Hospital here was just an amazing place and had so many great pediatricians and subspecialists to work with. So I was drawn into doing pediatrics. And then I think my residency program was probably, I got the quality of education I couldn't have gotten anywhere else in Canada. And then it was culminated by them asking me to be the chief resident. So to lead that residency program, to help mentor the younger residents, I mean, that provided me leadership skills that I still use to this day. So it was such a wonderful, nurturing learning environment, even back then, and I think it's grown from then. So that was a tremendous experience for me.
So I'm most proud of founding Wisdom, which is the Women in Science initiative at the Rady Faculty of Health Sciences. Through Wisdom, we have been able to launch an annual equity symposium, which is garnering national recognition. We have built networks and training programs for our early career researchers. Through these initiatives, we are organizing resources to provide professional development and mentoring for our women in science and medicine who will develop into leadership positions at our institution. And I really look forward to many more women leaders in University of Manitoba.
Well, it was a privilege to be a dean of a faculty with brilliant students and an accomplished faculty. Some of the highlights were, and probably the most important, was the creation of the Access program, which allowed a pathway for Indigenous students to study medicine. Also important was the establishment of the Community Health Sciences Department, which meant the faculty played a role in the health of not just in the university, but in the province as a whole.
My first day at the University of Manitoba really set the tone for the rest of my medical career. We were sitting down in a lecture theatre and we looked at a map of Winnipeg, and the lecturer said, if you look at the majority of the people in this room, we're all congregated here in the south. But if you compare the life expectancy between members of that community and those just in a 10-block radius of around Health Science Centre, the life expectancy difference is about 15 years. And that's a really incredible and terrifying statistic. And what I really loved about the University of Manitoba is that we did not shy away from those. We instead look to face them and to face the challenges that members in our communities face every day.
Over my 32 years in the Max Rady College of Medicine, one of the things that has really stood out for me is the development of research infrastructure, and that's for both clinical and basic science research. On the clinical side, the development of the Centre for Healthcare Innovation has really attracted world-class faculty to support patient-oriented research. On the basic science side, we've developed some amazing world-class platforms. So for example, proteomics, transgenic services, small animal imaging, and much more. And that's right here in Manitoba.
I'm proud to be an MD alum of the University of Manitoba because, as we've seen, it has brought diversity and inclusion to the forefront of our medical education. Back in 2016, my classmate and I, Dr. Tharunabu, were actually the ones who launched the Positive Space campaign on campus. Together we helped promote and facilitate the first Pride ceremony that occurred at the University of Manitoba, and of course the inaugural Pride flag raising ceremony, which took place here at the Bannatyne campus. Now, as we mark the 140th anniversary, we can see that Pride has a permanent home here. I'm incredibly proud of the progress that has been made at our university and specifically this college, and I'm very privileged to work with a group that is dedicated to fostering inclusive and safe education for everyone.
The highlight of my career here was receiving the Canadian Society for Immunology New Investigator Award in 2019. I couldn't have done it without the support of the medical school. What is my message? My message is that you have to continue to do what you're doing, serving humanity. You can relate on your words. In fact, medical doctors are needed even more now compared to before. And what is my hope? My hope is that in the next 10, 15 years, that you are graduating medical doctors who look like the community you are serving, and you're also putting in a lot of funding and money into research and to become one of the world leaders in research.
As an MD alum from the University of Manitoba, I am so proud of our leadership on issues such as social accountability, Indigenous health, interprofessional collaboration, and our EDI and anti-racism initiatives. I have met incredible young medical students and residents here at the University of Manitoba, at our College of Medicine, and I know our future is in good hands, and we are going to continue to lead on all of these important issues.
Well, you know, I had nothing but wonderful opportunities. I think I recognized very early that all of the students who come out of this faculty are very highly trained and very competent, very empathetic and very socially aware. So the opportunities I had really related to my experience in northern healthcare and in pediatrics, which really fit me like a glove and really helped launch my career. Again, we continue to work on issues of equity and diversity and inclusion, that we continue to pay a large bit of attention to the health of Indigenous people and the complete problems that they face because of hundreds of years now of discrimination and racism. I think all of those things need to continue if we ever are going to achieve the reconciliation with our large community and our Indigenous community going forward.
One of the absolute highlights of going to the University of Manitoba for medical school was the emphasis on rural and remote health. So while I was a student, I had the chance to go to Norway House, to Churchill, up to Nunavut as well, and learn not only from the healthcare providers that were traveling with me, but also from the locals who had such expertise beyond what I could have learned in a classroom. I also, when I went into residency, leaving the University of Manitoba, I felt so well prepared, and so comparing my experience to the other people when we were on call for internal medicine, there was really no comparison between the training that I received and what the other learners had come out with, and I'm just so thankful for the U of M and what it taught me.